Hi, everyone. Thank you all for coming to this panel discussion. We'll just do a quick round of intros so everyone gets familiar with who's on the panel. The topic of the panel is, what's the prescription for the digital age? And this is sort of highlighting how do we advance what's happening in Pakistan in healthcare. Obviously, as a percentage of GDP, government spend on healthcare is not one of the largest. So there's a lot of pressure on private sector companies and some of the people on this panel as well, that how can we introduce innovations that allow us to leapfrog what's happening here, maybe learn from other markets. We've got Dr. Henry who's here from Norway as well. And how do we figure out where the problems lie, and then what are the solutions we can bring in. So if we can just do a quick round of intros.
My name is Khuram Iqbal, and I'm a medical doctor in Norway. Originally, I'm from Pakistan, a place called Gujarkhan in Rawalpindi. So now I'm starting a new journey with Digitrends in Pakistan.
Yeah. Assalamu alaikum, everyone. Just want to say thank you for inviting me to come here. It's my first time in Pakistan. My name is Henry, and I'm also a medical doctor from Norway. And together with Khuram, I came here to explore and see how Pakistan is compared to Norway. And yeah, I'm happy to share my thoughts.
Hello. Assalamu alaikum, everyone. This is Sama Salim, CEO of Digitrends. We are a health technology enabler, leading health technology enabler company in Pakistan. We provide solution to private and public hospitals in Saudi, Dubai, and Pakistan. And recently, we registered a company in Norway with these two doctors' help. So, and actually, it was Future Fest. I should thank because of the Future Fest, and Future Fest team. I met Arzish and I went to Norway with him. And because of Arzish, I met these two young doctors, gentlemen, who are now partner in Digitrends Norway with us. Thank you.
Assalamu alaikum. My name is Talha. I am the CTO, Chief Technology Officer of Digitrends, and have been in the industry like since 25 years. And contrast of that expertise, I'm just the one who convert the ideas into the technology, and that's what I ask. Thank you.
Great, so we're going to learn a lot about Digitrends in this session, I'm sure. I'm Hyder Mumtaz. I'm the CEO of Ailaaj. Ailaaj is a health tech company focused on providing services directly to patients in the realm of telemedicine and pharmacy services across the different value chains. So guys, I mean, just to sort of lay the land a little bit, healthcare spend today in Pakistan is roughly about $8.5 billion per annum. And about 40 to 45% of that is spent on medication, about 20% of that is spent on diagnostic services, and then the balance is done through consultations and through other sort of hospital services as well. Where do you think the biggest opportunity is, right? Where should we focus first in terms of these different problem segments? We'd love to hear from the doctors because, from a clinical impact point of view, I think that's going to be a really interesting viewpoint.
Thank you very much. I want to start from a personal experience. I'm born and raised up in Norway and became doctor, and my father wanted to build a clinic or hospital in my village. In Gujarkhan, it's a village called Chakri Wakila. So I have 3 brothers who helped me, and we built that building, and then we were ready to start a new clinic in Pakistan. So we started in 2022, and we faced a lot of challenges. Me and Henry, we are working in one of the world's best healthcare systems in the world. I'm not aware of the figures there, but I think figures of how much we use on health, like 8 billion or something in Pakistan, and then let's see, it's 250 million population. In Norway, we have 5 million, and we use approximately the same amount. So that's a huge difference. So it was a big challenge for me coming from that country to Pakistan, and said, okay, my dream was to implement what I can in Norway and implement in Pakistan. So I hired one doctor and we started to collect equipment. It was a nice journey. I found everything I wanted, beds and everything. That was not the issue. And when we were start working, I told the doctor, why don't we buy a computer and start? He said, why do you want to buy a computer? I said, I want a computer because in Norway I can't work without a computer. We have electronic health records. He said, no, it takes time. It takes time for what? No, then I have to write all that. I said, okay, we go to a printing company and they made new pads for us with the name and all that, and pen and paper. So it was really challenging for me that I would start with pen and paper again. Like since I was little, I've only been using computer in my medical studies and my medical profession at hospitals everywhere. So it was the first challenge. Second challenge, when I was going to order medicines, doctor using his precious time, calling to pharmacy and ordering 3 of these, 2 of these. I said, hello, let's automate it. And then again, no, it takes time. The thing was that it was not that it takes time, but the challenge was that he didn't want to. Or we as humans are afraid of change. That's the human nature, that we don't like change, because then you have to come out of your comfort zone and learn something, and that's what was the biggest issue. And the third one, again, was the health literacy. In Norway, if I tell a patient, this is the medicine for this disease, he'll accept, go and trust you. But in Pakistan, when I gave a medicine, or my doctor gave a medicine to one patient, he went to the corner, he said, yes, I went to this hospital of Raja Javed. He had a hospital, and the doctor gave me this medicine. Oh, no, don't take this one. You should take this one for that. So his friend sitting in a corner or a barber shop is giving him another advice, then he starts with that. So again, I think the main challenge for us in Pakistan is the health literacy. First of all, so people understand that. And that's why I then met these guys in Oslo, and I wanted to know some people who can help us out of this. And then they showed me that how much they could actually do. So that's why we are here to learn from them about how I can make clinics, and I have a lot of overseas Pakistanis who want to do the same, but they're afraid for how things are here.
Thank you.
So great. So, I mean, that's really interesting insight. What we're hearing is that digitization of patient records is very, very important. Digitizing the pharmacy supply chain or methods is super important as well. And the third is health literacy, and I would put it into a different category almost. A lot of the population is looking for instant relief. And if you look at the area that you're talking about in those sort of tier 3 cities or village environments, people want that instant relief. They won't understand that you've given them a medicine that might take a week to solve your issue. They'd rather have an injection, God knows what's in that injection, but feel better in an hour. So very insightful. Samad, a question for you. You've been in the tech space around healthcare for probably almost a decade, I believe. Yes. And you guys are probably focused on different things throughout your journey. I'd love to hear about what you guys were focusing on 10 years ago, and what are you guys focusing on now?
Sure. So 10 years ago, it was like we used to do telemedicine on phone calls, and we didn't have any mobile application, and we used to develop desktop application for EMR. But this is unfortunate that since then, we have been trying to convince the major hospitals of Pakistan and the mover and shakers of healthcare industry that we should have centralized EMR for Pakistan, as you mentioned. But up till now, unfortunately, it is still a dream, which is, I think, a mandatory first step to improve the healthcare system of Pakistan. And from last 10 years, we are working on it, and still we are working on it. Technology has been advanced. Now we have introduced mobile application. We are working on remote patient monitoring with King Saud Hospital, one of the leading public hospital in Saudi Arabia, Riyadh. So we have developed the solution which is one of its kind over there in Saudi and its world like. But unfortunately, we are still trying in Pakistan to launch our EMR. We call it Chotu EMR. Now we have changed our direction. Like we wanted to sell it, or we wanted to partner with the leading hospitals, and we wanted to try convince the government, but now we are changing our approach. We are now going to launch our EMR to the public level, to the consumer level, free of cost. And we are hoping when we will be having a data of, let's say, 500,000 people or 1 million people in a year or so, maybe in 3 years or 2 years or 5 years, I can wait, that's not the issue. So by then, the government or the leading hospital maybe come to us that by then we will be holding the largest EMR data, patient data of Pakistan. So this is the thing we are working on. And, but we need partners like you. We need support from the healthcare industry for this. And Alhamdulillah, we have been blessed that some of the major, you can say, hospitals and individuals have supported this idea, and they are working with us on this initiative. And that's it. So nowadays we are working on the advanced technology, but it's outside Pakistan. We are integrating devices, we are doing remote patient monitoring, but in Pakistan we are still trying to launch EMR. Talha?
So really interesting, 10 years ago, Digitrend said EMR is the problem to solve. And today they're still saying EMR is the problem to solve. And it's not that the technology wasn't built, it's that how do we get this population to adopt it? And yes, you can make things easier to use. Before it was on a desktop, now it's on a mobile app. But really, how do you catalyze the whole ecosystem to say, now this is the de facto? And one thing that I'd like to share about what Ailaaj has learned over the past 4 or 5 years, you can introduce the most cutting edge technology, but when you need to connect into multiple players, especially government organizations, where, again, remember, GDP spend, healthcare is what, 2.5%, 1.8%? It's not let's be honest, is it the primary focus? No. They've got bigger issues to deal with first, then health comes in. And so what we've seen over the past 18 months in the diagnostic imaging space is that we wanted to bring in a lot of innovation. We had things prepared. And so rather than say, let's partner, let's convince this hospital, that hospital to work with us, we went out and said, let's do this as a public-private partnership. We will run these now. And so you'll hear this announcement soon in the press, but Ailaaj is now going to be running a public-private partnership in the diagnostic imaging space across 24 different hospital locations in Punjab alone. And this is our small way to say, okay, can we help leapfrog? Can we help change things rapidly? Not just one hospital at a time, but let's try and change 30% of the market. On that note, Talha, we'd love to hear your thoughts on how can AI help in diagnostic imaging? We'd love to hear what Digitrend is cooking in that space.
Well, I guess around, you must be heard the name of IBM Watson, right? I guess around 5 years back I saw there was a kid working in the IBM, and they create a retina detection AI program, which in theory, because they have a lot of models collected from the different doctors and the other institutes, so which was against the theory that it was more accurate than any of the doctor in the world. So having the AI, I guess it is will help us a lot of accuracy in the diagnostics, where in Pakistan, in the third world countries, we have the doctor sitting just in the street and just doing the operations and other stuff, just like the dentist and things like that. So if we make these sort of technology available to the mass people around the world, so that will help us. I mean, I guess that will save the lives of a lot of patients going into the wrong diagnosis in the first place, and just be the more accurate and more perfect.
So standardizing outcomes from an imaging process is very, very important, and it'll allow us to scale.
Exactly.
For the audience, I mean, not to keep this too technical, but someone who gets a CT scan in Bhakkar should have the same outcome in terms of a report as someone who gets it from one of the larger hospitals in Lahore. And that's the goal, right? To standardize outcomes over there. Dr. Henry, we'd love to hear from you on best practices from Norway in the field of patient empowerment, or sort of the patient centricity setup of the healthcare system in Norway, What are some of the best things that you guys are doing out there, and what could we implement down here in Pakistan?
Yeah, so let me just share some basic information about the Norwegian healthcare system, because I'm sure a lot of you have probably don't know about this, but in Norway we have this primary healthcare system where the GPs are sort of the foundation of the system. So everybody who's sick needs to go to the GP first, and Norwegians are assigned a GP to follow them from they are born until they die, or you can say it, you can put it that way, like, so the Norwegian government wants you to have a GP that follows you throughout your life. And I think that's a really good way of doing it, because your GP will actually be able to detect and also understand you as a patient by having all these records of your whole life, and also to understand what kind of like symptoms and how you are as a person, your lifestyle. And that way, the Norwegian medical system are also saving quite a lot of money on doing this. And when you are getting, let's say, some symptoms and the GP can't help you, then the GP will refer you to the hospital. Yeah, so that's called specialist care. That's one way the Norwegian healthcare system are able to provide, like, you can say, like, a sufficient system. There's other ways they're doing things by doing more preventive care. We as a nation are also very focused on how to prevent diseases, not just about treating diseases. So if you look at the healthcare system today, there's a lot of systems that are actually doing what we call sick care. And sick care is basically waiting until you get the disease before you treat it. In Norway, what we want to do also is to prevent diseases. And by preventing diseases, I mean we look at lifestyle factors, but also the nutrition and how that impacts the different diseases. So if you look at the numbers of life expectancy from Pakistan and Norway, the Norwegian life expectancy is around, I think, 84 years old. And in Pakistan, it's ranked as 155, according to some rankings on the website I saw. And the life expectancy is around 66 years old. So it's a huge gap between like Norway and Pakistan. And then we can question ourselves, like, is this because of lifestyle and nutrition, or is this something else, right? And I believe after being here in Pakistan, I think there's this is from my personal experience, right? So I've only been in Pakistan for a couple of days, and when I'm going out to eat, I can tell that in Norway we have something called like nutrition values. Like there's nutrition information on all the foods that you eat. When I go out in the restaurants here, or when I'm looking at the food, I don't see that much labels. They're not like labeling like fat, proteins, carbohydrates that we do in Norway, and that way the consumers can choose what to eat, what is healthy, what is not healthy. We're able to kind of like empower the person to take the right choice.
So, no, very interesting. I think prevention versus cure is always a very interesting debate. In Pakistan, Samad, have we seen certain organizations or certain healthcare systems create a formal structure around this? That how do they have systematic prevention efforts?
Yes, people are working on patient safety and awareness conferences, but I have not seen any institute or any department of government who specifically work like the way he said, there is a healthcare and there is a sick care. So we don't use these terminologies here. We don't educate our patient, our people, that we should, and that's why there is a 20 years gap of life expectancy, which he has just mentioned, because our lifestyle is not that up to the mark where we can actually prevent ourselves to get into more diseases. Unfortunately, Pakistan healthcare system is not evolved up to it 100%, not up to it 80, 90, 70%. And it should be on priority because if we will be a healthy nation only, then we will be become a wealthy nation, I rather say. So we are working on it still. Like we have our we used to work. We work with pharmaceuticals as being digitrends. We are working with all the leading multinational and national pharmaceuticals of Pakistan, as well as in Dubai and Saudi. But as we are, the topic is Pakistan. So credit goes to private department that they do do these kinds of seminars and exhibitions and events where actually they sponsor the doctors who educate patients, who educate doctors as well to educate their patient for the prevention of the disease. I think that's.
So what we're hearing is that healthcare institutions might not have set up formal programs around prevention, but the pharmaceutical companies, because they're doing disease awareness and education, there's something happening there. But really, I think learning from Dr. Henry, you're saying there's a dissemination system in place in Norway. Yes. There's an inherent referral system that's there that allows you to create these programs, but then also make sure that they get disseminated at the grassroots levels, and then that's taken upwards to specialist care as well. Yes. Dr. Raja Khuram, I don't know if you ever practiced medicine in Pakistan before, but we'd love to get your view on the healthcare system in Pakistan. I'd love to have a debate across the panel here, because there is a referral system in Pakistan. The British set it up. It's the same system that's in place. There's basic health units at the bottom. Then there's rural health centers, there's trauma centers in parallel, there's tertiary care hospitals, there's district level hospitals. So this referral system was designed like this. What are the gaps? What are we doing wrong here, and how can technology help us?
As Henry's mentioned, that the primary healthcare system is the backbone of health system in Norway. So what I experienced, even I did clinical practice here, but I had a doctor, is what the people, when they have something, they go directly to the secondary, like to the THQ hospitals. And if you ever go to THQ hospitals, you see a crowded area, because people go, because first of all, it's free. So finance, it's an important role here. As in Norway, 90 to, I think 95% is total government who pays for you. So according to Pakistan, it's only 90, opposite, like most of the people pay by themselves. So
I think it's almost, 70%, 80% out-of-pocket spend.
Yes,
in
that's
Pakistan.
True. Yes.
Yeah.
So the main thing where technology can help me at the clinic, I'm now, I have to close it, we are going to do some reconstructed there, so is that I will use, with Digitrends, we are going to make products, inshallah, that will help us to do this kind of health service accessible in my village. But also, Norway is an area as big as Pakistan, but as population, we are only 5 million people. So in Norway, there are areas there are only 300 people living, and government, they make sure that there is a doctor there. Only for 300
Wow,
people,
okay.
Government makes sure. But again,
and is that a physical presence or is it remote presence?
Yes, physical
Okay.
presence, and it costs the Norwegian government a lot of money. And there are often debate we don't have like in UK, in Europe, we have an elderly population growing really drastically next 10 years. So they have a manpower issue in the health sector. So also to kind of...
Same in Pakistan. We have a major manpower issue in Pakistan.
So to reduce that in Europe or in Norway, first of all, we will go together brainstorming technologies that can help us to actually provide good doctors at this remote areas in Norway as well. Because to get a doctor, actually it's really hard because no one wants to live there as a doctor, 300 people, and after 5 o'clock it's dark. So that's a challenge. That's why we talk together, me and Digitrends and Samad Salim here, when he met me in Norway, that I have some challenge. In Norway, despite it's a rich country, they have their own challenge. But as Pakistan has other challenges, but how we, with our experience, can use their experience together to make a change.
So super interesting, and it's so insightful to hear that Norway has similar supply gaps that Pakistan does, and there are very interesting ways to learn from Norway. I did not know that it was such a large, expansive country in terms of square footage, and other countries like Indonesia as well, where the same issue exists. There's a 250 million population there as well, but there are 1,400 islands. How do I make sure there's a person on every island who can deal with that population? You know, I'm just being mindful of time. I don't think we have much time left. So I'd like to just, you know, maybe run across the panel one last time and close out with Dr. Henry and get everyone's thoughts on, you know, I love this Norway-Pakistan connection, right? I think there's something to really leverage there. If from this panel we can, you know, come up with a short list of 4 things that this Norway and Pakistan connection should unlock in healthcare. And let's make that sort of commitment, and let's all try and work together to do that. Should we start with Talha, please?
Yeah, so I guess what I've seen, like they have the technology, but the resources, I mean, the human resources are lacking in their case. And here in Pakistan, we have the human resources available, but the technology is not there. So I guess if we merge, solve this sort of problem or connect this sort of connection in between the world and the Pakistan, so that could be helpful, very helpful. So that's the thing.
Very insightful. Dr. Raja Khuram, your thoughts?
Yes, because you know, I was just to end up with the thank you everyone who have been listening to us. Norwegian Pakistanis is biggest diaspora of non-Western foreigners in Norway. So we are the biggest, it's only country in the world I think where the Pakistanis are major non-Western immigrants. So it's a lot of...
So the most amount of expats in Norway are from Pakistan?
There are a lot, but you know, they have this trust issue with Pakistan. That's another thing we want to say. We have my friend Henry. He came with me to Pakistan after only talking with Samad on Zoom 3 times. So it's a great, I think we should clap for Pakistan, everyone, because to come to Pakistan, for him it was a big, big gesture.
Thank you. So, yes, we are far in technology when it comes to Norway, and we are learning from there. When we went there, we were really impressed with the technology, with the adaptability, with the system. But there are some products which we developed in Pakistan for Pakistani doctors, which actually they were looking for in Norway. And that's why we partnered, and that's why we formed Digitrends over there. The product which I am mentioning is the patient simulation, where a doctor can be trained how to treat a patient if he has a heart attack, or how to treat a patient if he has an accident in an emergency. So you cannot give him a real-time patient to experiment. So we developed one solution for one of our clients here in Pakistan. It's a multinational company. And that was the real-time simulation of a patient who has a heart attack, and you have like 5 to 8 minutes to treat him. And that software they wanted to develop over there in that region. And when they came, I was there as a speaker just like this, and Khuram came to me and he asked me that you're working in healthcare, we have something in mind which we want to develop. And then they told me their idea. I said, I already have this product. And when they see it, they said, wow, this is how, like, so the point is, we are not behind in technology, but we are behind because of the, you can say, the system. It's not placed, willingness is not there. But now, people like you, I'm really impressed, mashallah, the way you are working for the industry, for the complete healthcare industry. And there are many other people you must know, we know all them.
We all have to play our role.
Yeah. So we are playing, and youth is coming. They will do their part as well. So hopefully, we will adopt those facilities, those functions which are already there. And now as they are over there and they can see there, so they are coming to Pakistan very frequently. They will help us as well. They are 2 young, you can say, boys who can help us in refining this system as well.
So wow, I did not know that we have now started exporting healthcare IP to Norway, and I think this is something we should really capitalize on, guys. Dr. Henry, your closing thoughts? I mean, we'd love to do a lot more with Norway. We'd love to have you and a lot of your professional community across in Pakistan as well. How can we do that? Where do we need to focus?
So, hey. So I think like Pakistan have a huge potential. Like from the small thing that I've just seen in Pakistan, I see there's a lot of potential. You guys are like an English-speaking country, and then also, as I understand, like internet is pretty cheap here, and everybody have a mobile phone. So if you just bring all these things together, I think like we can basically like share knowledge, and by sharing knowledge around like both healthcare but nutrition also, we're able to like educate people, right? And when we educate people, I'm pretty sure like the young generation here in Pakistan are able to also provide like better services and develop better healthcare service, not to mention other things in the tech community. And I believe that by using technology this way, you're able to actually close the gap between like Pakistan and Norway.
So that's the statement of this panel. Let's close that gap. All right? Thank you, everyone. Thank you, all of you, for coming
Thank you
down
so
to
much.
Pakistan
Thank
and
you.
being on this panel.